hysterectomy is a common surgery for many women. A lot of you recognize this telltale line across the lower abdomen. But with today's technology, that scar and longer recovery times are no longer part of the process. Here to tell us how that's possible, please welcome Dr. Cor Law and his patient, Velma Alston. Good morning. All right, so I'm going to start with Velma because what you're going to talk about is something that a lot of women can say, yep, and they can check that box, check that box, check that box. You had your children.
Yes.
And then things started happening that were just worrisome.
Oh, well, I had my kids, and then I just started having extremely painful cycles, and then like spotting throughout the whole month, and it just was getting to the point where we started talking about it, and he was just like, well, this is something you would think of, and I was a little scared about it at first.
Yeah, a hysterectomy?
Yeah,
and you're scared of it because what happened with your mom?
Oh, because I saw my mom. She had this huge scar. The scar got infected, and then they had to recut it.
Yeah. She's walking around hunched over.
For 3 weeks, she walked around holding her stomach, and so yeah, I was extremely nervous, and then we kept talking about it.
Because there's a new way of doing it, Dr. Law, and so I want to talk about that new way in just a second. But first I want to back up a little bit. What happens when all of a sudden we could have cycles that were normal and everything was fine, and then all of a sudden, like, something wreaks havoc?
Well, sometimes it's anatomical. You can have polyps or uterine fibroids or endometriosis, and it may not show up earlier, but as time goes on, they get bigger and they cause problems. And then you have hormonal problems also. So, you know, we try to treat it conservatively with medications, or we wait, but then...
Or if you have a hormone imbalance, fix the hormone imbalance. But
that's right.
Other times,
but sometimes you have to resort to surgical management.
Yeah.
So.
Okay. So a lot of women, when you say hysterectomy, they go, okay, because they got to get it right in their mind. So you're kind of balancing it out. Am I willing to put up with the painful cycles and all that type of stuff, or can I just get rid of it, but I have to deal with the downtime, recovery time, all that stuff, because it was looked at as a major surgery. It still is a major surgery. However, what makes the difference today?
Well, one thing that's women always worry about with hysterectomies is they're worried their hormones are going to be off. But if we are just removing the uterus and we leave the ovaries make the hormones.
Okay.
So if we don't do anything with the ovaries, your hormones stay the same.
Okay.
Now, in the past, we used to do hysterectomies through an open incision, like that scar you saw.
Yeah.
But over the past 15, 20 years, we've been going more minimally invasive.
Yeah, but, you know, and with that said, not every doctor's the same. There are other doctors who don't do it this way, so you have to do your homework.
Well, more than 50% of hysterectomies now are still done with the open incision.
Okay.
But if you go to the right surgeon who's properly trained and experienced, more than 90% of hysterectomies can be done through minimally invasive procedures.
Yeah. When we say minimally invasive, you have no scar.
I have no scar.
So, if you have no scar, how did you do that surgery?
Well, let's backtrack. I used to do it through 3 incisions, 3 holes, one incision in the belly button and 2 in the lower abdomen. And recently, I've been doing it through just the belly button only.
So there's this uterus. Do you actually take it out of the belly button, or what's the...
Well, that picture right there is from, we do it a different way. That picture is from a robotic hysterectomy.
Okay.
Where it's also minimally
option.
invasive, but you can see the incisions are higher up in the abdomen. So even though they're small, you can still see them there.
Yeah,
right
but that's not that long scar that's going
through.
through.
No, that's better.
Yeah, that's better.
This is even better than that, in that the scar is hidden just in the belly button.
So you can't, I won't make you pull up your tongue so I can see, but you can't, so you can't even...
You can't even tell. When I woke up in the hospital, I just hurt right here.
Yeah.
This was it. And I was floored just from... I started to wake up.
There's Velma's incision.
There you go. You just had a hysterectomy.
That's it.
Yeah.
That's crazy. That is crazy. All right, so you said, it was a little sore. Obviously, you had major surgery, but it was not the recovery time that you saw your mom going through. And
not at all. I was up walking around the same day. You know, the nurses were like, well, here, let's help you. I'm walking around just floored because I just hurt right here in this little square area. And all I could remember was, like, my mother couldn't stand up straight for 3 weeks. And I'm just sitting here walking around in the hospital having... almost in disbelief.
In fact, the nurses had to remind you, you did have surgery, so calm it down, sister.
That was the main thing. They did. The doctors were like, do not let it fool you. you know,
Yeah.
you have to take it easy.
So, of course, the scarring was one thing, but
Right.
the other big thing is when you go minimally invasive, it's less trauma to the body, so you can avoid things like that infection that she was talking about.
If you have a smaller incision, you have less bleeding, you have less pain, and you have less chances of infection. Now, we make an incision about 2 centimeters through the belly button, and then I have an instrument that goes into the belly button. We have a camera and then 2 other instruments that go through that one little incision, and that's how we operate. And I always joke that it's like operating with chopsticks, but luckily I've been using chopsticks.
You've been using them for a while. You know how to do it. Well, guess what? I grew up in Taiwan and Japan and Okinawa, so I can use them too. But I'm not going to do surgery. I will not do surgery on anybody. But yeah, and you mentioned using the robot and the multi-port robot-assisted laparoscopy, right? And then so the point being is that it's gotten so much easier today, and people need to realize that if you saw someone else go through it a few years ago, just know that when you do your research and check around, minimally invasive is usually the way to go every time.
If anybody tells you need to get an incision, you need to get a second opinion from somebody who can really tell you
good at chopsticks.
who can do it. That's
Right. To get more information on the types of minimally invasive surgeries that Dr. Law performs, just log on to drlaw, that's L-A, .com, or you can call this number. It's 281-589-0156, 281-589-0156, and you did yours at West Houston Medical Center, correct?
And
then
Memorial
Hermann, Memorial City as well. All right. Thank you very much. Well, are you looking for a career in healthcare? There's